So the side effects management and prevention of the complication is something that we are always think about as a doctors. So the superficial peelings very rarely cause complication, which are usually not severe. It can happen transient, mild hyperpigmentation, redness during the first night, and the flare-up of the pimples that can be reported from the patient. For the deep peels, the risk of complication is significant and is usually transient hyperpigmentation followed by hypopigmentation or even total or permanent achromia. So the minor complication is the minutes to the hours to the procedure. This is irritation, burning, erythema, pruritus, edema, blistering, and also in a delayed fashion appearing over days to weeks. These include the development of acneiform eruption infection, bacterial, fungal, or viral, persistent erythema, demarcation lines, and milia. Pigmentary change that we already mentioned. And the major complication, which is very rare, it can happen. We see the patient with allergic reaction, or we can see allergic laryngeal edema, toxic shock syndrome. I never have this reaction, cardiotoxicity, salicylism, but acute kidney injury, lower lid ectropion, corneal damage that can also happen during the application of the peeling, significant scarring and dyspigmentation. So the first step in preventing all these complications that are really scary when we are talking is to identify patient at risk, the darkened skin types with a tendency to develop post-inflammatory hyperpigmentation, sensitive skin and history of atopic dermatitis, very dry skin and reddish hue, outdoor occupation with a history of photosensitivity or post-inflammatory hyperpigmentation, what kind of drugs the patient are taking, history of keloids, somebody who's already received isotretinoin, you have to ask what dosage is the patient is taking, and somebody who has a physiologically disturbed as a patient. Complication. So I'm going to mention all the complication and how to prevent it. So this is the most important thing is as a doctors that we can see during the chemical peels application. Swelling. Edema is expected and appears between 24 and 72 hours. And the edema is fairly mild, but it can be large enough to cause the eyes to shut. How to prevent? We usually give ice or antihistamines, and proper wound care are ways to avoid these several swellings. Sometimes we give systemic steroids such as prednisolone or methylprednisolone should be used in the patient who develops severe edema that lasts more than 72 hours, but some physicians choose to use it preventively, which can lead to the poor healing. Pain and burning. If you have a pain and burning, the intensity of the pain varies from the patient to the patient. It can vary from a low to very high intensity. In medium deep peels, the pain lasts for only a few minutes after the application of the products, and it's rarely necessary to prescribe pain medication to the patient, but I give to the patient lidocaine cream can be used to reduce the pain without affecting the peel penetration. Deep peels usually generate more pain and tends to increase the hours after the procedure, lasting a maximum even at 12 hours. So if you have prolonged sun exposure, if you have deficiency and application of sunscreen or using topical retinoids or glycolic acid immediately after peels can prompt this complication. So also sunscreen can cause contact sensitization or irritant contact dermatitis. So pain and burning is typically experienced during a peel procedure in a sensitive skin. So if you have the patient who has a sensitive skin, who has atopic dermatitis as a child or still atopic dermatitis as an adult, you have to ask, you have to see the skin before start doing or applicated the chemical peels, because this will lead to more pain. So how to prevent it is immediately ice application that reduce pain and burning sensation. Potent analgesic may be necessary. Topical calamine lotion can be used to soothe the skin. Topical steroids, I always prescribe topical steroids such as hydrocortisone to reduce the inflammation. maybe twice per day for 2 days, emollients, but not immediately, but after 2 hours after topical steroids to moisturize the skin, and sunscreen can help prevent post-inflammatory hyperpigmentation. Usually, we say if you have inflammation and you apply emollients, of course, there'll be a lot more burning, more sensation. So that's why we prefer to give topical steroids and then to wait these topical steroids to reduce the inflammation, then to apply emollients as a moisturizers. Resistant erythema. I think most of us, the doctors, we usually have this situation after chemical peels that can also be results from the angiogenic factors that stimulate vasodilatation, that indicates the phase of the fibroplasia is being stimulated for a prolonged period of time. So skin thickening and scarring, and it can vanish in 3 to 5 days in the superficial peelings, but it's, the patient are concerned why there is erythema that is lasting 5 days in the superficial peeling, although it's a superficial peeling, or 15 to 30 days in medium peels, or 60 to 90 days in the deep peels. So the cause of the persistent erythema is the topical tretinoin immediately before and after the procedure, or oral isotretinoin administration during the peel, alcohol consumption, contact dermatitis, contact sensitization, and some pre-existing skin condition, rosacea, atopic dermatitis, lupus, if the patient is not telling what kind of condition he has, and also outdoor activities. We have patients that usually after the chemical peels go to the swimming pool or some spa treatment or sport activities, and then this persistent erythema is making worse. Tips to prevent it, I always give topical steroids that I usually manage the patient, or I contact the patient for 1 to 2 weeks. Hats and sunscreen and continuous emollients, cosmetic camouflage can be used to minimize erythema during the treatment. And if there is no cure for this, we apply intensive pulse light or pulse light laser as devices. So this is the picture how the permanent resistant erythema looks like after the chemical peels. Another issue is that we have as a cessation from the patient is the pruritus. This is due to the reepithelialization and typically begins in the first 2 weeks after the treatment that continues for approximately 1 month. And it's more common after medium and deep chemical peels. So the patient always say, I have a dryness. It makes me to start itching, to start scratching after the chemical peels. How to prevent it? I usually prescribe oral antihistaminics and topical hydrocortisone creams. So we are going anti-inflammatory, anti-allergically for this condition. Ocular injuries that also can be part of the complication, corneal harm. It can happen during the application of the chemical peels because the cotton-tipped applicator to immediately remove the tears near the lashes, and we apply syringe filled with saline in case of an accident with an acid solution inside of the eye. Another issue is allergic reaction or allergic contact dermatitis, which is very common with resorcinol, salicylic acid, koic acid, and lactic acid. We always give antihistaminic, and of course, the challenges here is to differentiate an allergic reaction from erythema and swelling expected from the peel. But if the patient has a history of an allergic reaction to any peeling agent, then we give antihistaminic prophylaxically before, during the chemical peels, and 5 to 7 days after. Another issue is blistering that typically occurs in the younger patient with loose periorbital skin and around the eyes, because the skin is very sensitive here and it's very tiny. And tips to prevent in the nasolabial folds, the internal contents of the eye, and the corners of the mouth, we apply always petroleum jelly to avoid application or to avoid the dilution of the chemical peels around the mouth, around the eyes, or around the nose. Folliculitis and acne, it also can happen after chemical peels. So tips to prevent is oral antibiotics that can be used in this case, and the eruption usually vanish with a week, or we can apply local antibiotic on this on the pastels, on the papules. But another factors that can also be happen is infection. These factors can contribute by the growth of microorganisms such as the streptococcus, staphylococcus of pseudomonas. And the clinical feature of the infection are postponed wound healing, folliculitis, ulceration, and crusting. And tips to prevent is to compress of 0.5 acetic acid soak 3 times of a day until the crust disappear, or using intranasal topical antibiotics ointment. So this is how it looks after the medium pill. The patient has a bacterial infection, and you can see persistent erythema and scarring after that. Candida is another issue that can also happen during the peeling. Candida infection can occur and very difficult to distinguish because the skin is very irradiated. So superficial pastels often occurs in the candidal disease. So predisposing factors for candida include recent intake of the oral antibiotics. So you have to ask the patient recently, does it took any medication? What is if he has a diabetes, or if it has used prolonged topical steroid use. So tips to prevent, we give topical clotrimazole or systemic antifungals as treatment. Herpes recurrence, it can also happen. This is the onset of the herpetic eruption, may vary in duration, 5 to 12 days after the procedure. We always ask for the patient if he has a herpetic exudation during these 6 months before coming for the chemical pills. The treatment, we always prescribe a local anti-virostatic cream, or we can give therapy with acyclovir or prophylactic treatment. If the patient, we see the patient before, and the patient say, yes, doctor, I recently have a herpetic infection, or I have 2 or 3 times per month herpes simplex during this month. So we give prophylactic before coming for the chemical pills. Acyclovir 5 times per day, 20 milligrams. So before coming, the day on the chemical pills, and then 3 days after. And another issue is hyperpigmentation that can happen if we apply in the jaw neck region, where untreated skin of the neck appears different from the newly rejuvenated skin from the face. So we see a porcelain appearance, also known as alabaster-started looks, that can be observed after erythema fades, and it's characterized of the phenol pills because of the direct melanotoxic effect of the phenol. So you have to watch out and to be very, with the procedure, very nice, and go through the line of the neck, because otherwise the skin will be different, the skin on the face and the skin of the neck. Hyperpigmentation is also factors leading to the high risk of the hyperpigmentation, include the skin types for Fitzpatrick 3 or till 6, and following intense sun exposure and tanning, use of the photosensitization agent, early exposure to the sunlight, and use of the estrogen-containing medication, such as the oral contraceptive and the hormone replacement therapy. The tips to prevent, we give hydroquinone with the trethionine to increase bleaching effects when the skin is healed, vitamin C, koic acid, and azelaic acid, and a superficial peeling is used to expedite the results. Something that we really very often we see, it's amelia, it's our inclusion cyst that appears as a part of the healing process that is reported up to 20% of the patient. And we use the retinoic acid before and after the procedure to reduce the appearance of the amelia, or it can generally regress spontaneously and should be only treated if the patient requires. Inclusion cysts, we extract by needle or lancet, removing from the skin. Scarring is another point of the complication from the chemical pills, especially when we have The lower third of the face most frequently occurs in the areas related to the movement for speaking or eating, and this area is also associated with the highest frequency of intervention. The tips to prevent we give after this: high potent topical steroids, dressing and antibiotics if it's necessary, intralesion injection of the steroid, silicone gel, or intensive pulse light and pulse night laser device. Surgical correction can be made only after a minimal period for the 6 months. This is the scaring after the application of the chemical pills. Complication with specific peeling agents, I will not go through, but it can happen: phenoltoxicity, resorcinism, and salicylism. And as a conclusion, if complication occurs, you must be able to address them in the best possible manner to avoid the outcome. And never forget to inform the patient of the potential complication, and always establish a good balance between the patient expectation and reality. And it's a take-home message as a dermatologist, as then it's better to have this satisfied patient with the partial results that can be easily resolved with a new application or a new procedure is better than to have a patient with complication. For professionals who are new to the use of the chemical pills, use common sense. Do not seek quick results and use the correct indication, because we always, when we are starting with the chemical pills or any kind of devices, when we see the protocol, we just go through the protocol, but don't hurry up. It's better to start even with the superficial peeling to at least to see the effect of the peeling and how to manage with the superficial peeling, whether to start or to jump directly to the deep peeling, or to start it with something which is new.